You're 52 years old, you have heart failure, your kidneys are failing, and you have early signs of liver failure. Your legs are swollen, and you're losing about half of your protein through your urine. Your medications are simply not working, your blood pressure is still too high, and you're essentially chair-ridden on oxygen. What should be your next move? Welcome back to Montgomery Heart and Wellness, and as usual we have another exciting clinical rounds case. This one seems to be straightforward on the surface. This is a 52-year-old man who had what we call nephrotic syndrome. He had heart failure, and so the nephrotic syndrome is the nephrotic being with the kidneys, some kidney failure component, and he also had some liver cirrhosis.
Yes, and in addition to that, he was always on oxygen. He had the pulmonary hypertension. It's really a lot of different organ dysfunction going on, and he came to the office very swollen, lots of leg swelling, more out of breath than normal for him, just really not feeling well. So we needed to start him quickly on a raw diet, and you put him on that for almost 100 days.
I don't want to sound derogatory, but in medicine, patients with this complex health condition, the health condition is considered to be like a train wreck health condition. And lots of doctors refer to this in internal medicine. Patients come in with a multiple organ dysfunction. And it's almost like the body's been in a train wreck. If you've been in a motor vehicle accident, different parts of the bodies are damaged. So this is a medical train wreck condition. So we have multiple organs that are dysfunctional. Not only do they not support each other, but the dysfunction of one organ contributes to the dysfunction of another. So if the liver is not functioning well, it's not clearing the blood well, then the blood itself is full of toxins, so then the heart doesn't function well. If the heart's not functioning well, it's not circulating to the kidney, so the kidney doesn't function well. And then, of course, if it's congested, pressure builds up in the lungs, you get the hypertension in the lungs, which then spread the pressure to the liver, which then further compromise liver. So you get this whole cascade, a negative cascade of things with multiple organs that are not failing. And the difficulty with this is oftentimes when you prescribe a medication for one organ that's failing, then it may have an adverse effect on another. So what did you do for this man?
So the nutritional detox, that fixes everything because it works at the cellular level. It fixes the whole body system at once rather than a medication for one particular organ.
But it always starts with a nutritional detox. It has what's called a pleiotropic effect. It has positive effects on multiple ways and multiple organs. And I like to describe it as someone like him who has lots of systemic inflammation. It puts out the fire. And so the thing that we did is immediately with the detox, it starts putting out the fire. And it doesn't take weeks or years to have an effect. It takes effects on the order of days, maybe even hours. And so we were seeing him weekly for about a month and a half, and we saw his clinical presentation improve. And so he was just simply getting better on the raw detox diet. He actually tolerated it well and actually enjoyed it.
He lost 23 pounds. His leg swelling was gone, and we took him off 4 medications that were for blood pressure. So that was tremendous. His blood pressure is actually better off the medications than it was beforehand when he was on the medications. So he was feeling so much better, and that meant a lot to him. He always talks about his son, I remember, and wants to be there for his son growing up and going to all these activities, and it really meant a lot to him, his physical transformation, and his ejection fraction really increased a lot too. It went up from 40% to 60%.
Wow, impressive. So a very simple, straightforward approach for a patient with a complex set of illnesses can be very, very effective. And so I really hope you got a lot out of this. And one thing I want to leave you with is that this is something that you can do on your own. Now, granted, we always want you to have medical supervision with your doctors for all your complex medical problems and medication adjustments. But eating a raw, plant-based, healthy diet is something that you can do on your own. So just keep that in mind. So we want to empower you with this knowledge and encourage you to take use of this information and apply it to your lives. So I hope you got a lot out of this. And of course, until next time, take care. Thanks for watching. If you got value out of this video, please like it, subscribe, and hit the notification button to see